We're going to talk about Buzzy Best Practices. And by the end of this, my hope is that you will all know more than anybody about how to use Buzzy and be able to answer questions. So if you're familiar with the concept of too long, didn't read, we have a TLDR here. So we're going to start with the Buzzy basics. Too long, didn't read. Here's the basics of how to use it. We're going to do a quick overview of the two most common procedures done with Buzzy, which are IV and IM. Then we'll talk about introducing into a hospital and including the nitty-gritty like payment and how you get the staff to take a new device. And then we'll talk a little bit about troubleshooting. After that, for those who want to stay for the science, we'll talk about why Buzzy works and the concept of physiology, fear, and focus, how we know now that the brain processes pain so that you can not just use Buzzy for pain relief, but also to make the experience processed better. I'm going to talk a little bit about vasovagal syncope and fainting. One of the main reasons that people use Buzzy as adults is because it blocks the vasovagal signal, and so you don't get the same nausea and fainting. We'll talk about that. And then a little bit that we've learned from the research that's been done on Buzzy, 80+ papers, 5 meta-analyses, and it's told us some sophistications that we didn't know when we first started with this almost 15 years ago. If you have a question, put the question in the chat, and if I don't answer it live, then we'll have a time for Q&A at the end. This will be recorded, so your staff and others can use this and access this for information later. So, first of all, what is Buzzy pain relief? So Buzzy is a reusable device that vibrates in the frequency to cancel pain. It has optional ice wings that can increase the numbing by 10% for IV access and up to 50% for intramuscular injections. You can see here a child holding their own Buzzy for an IV access, and you can see a nurse who's holding hers in the proper position to get her COVID vaccine. To prepare Buzzy, you want to fold and place the ice wings in a freezer 30 minutes before the procedure is needed. The reason for folding is to make it fit easily under the strap or to conform to the arm once it's been done. You want to remove these immediately before use. The ice wings have a calculated thermal energy that cannot cause frostbite even in infants. Because of that, it will also melt quickly. So you want to have it ready to do right before the procedure. You're going to attach the frozen wings to the back of the unit, over the hook on the Mini, or under the silicone band in the XL. This is the hook in the Mini. This is the band in the XL. So you'll hook the ice packs on or slip them under the strap. Now, let's get into it for IM or subcutaneous. So looking at our easy to use instruction sheet, once the Buzzy's vibrating, you put it in place where the injection is going to go. Now, it can be held on with the personal unit with a Velcro strap that comes with the device. It can be held on by the patient. A parent can also hold it in a comfort position, so it can be an arm around the child or the young adult, keeping it in the place, and then the nurse or the practitioner is going to adjust it so it's on the deltoid where the IM will be given. Step 5, when you're ready to give the injection, slide Buzzy 1 or 2 centimeters proximal in the same dermatome. Now we'll talk about dermatomes for injections that are not in the arm, but in the arm, the dermatome nerve pathways are going to go straight vertical. So just slide it slightly up and then clean the site as you normally would. Step 6, give the injection with the immunization as close as possible to the bottom of Buzzy. So we'll talk about the dot in a second, but we put a little dot in so that you can see how to position the needle, and you want to inject near the center of Buzzy's lower edge. If you look here on the bottom, you can see this woman has it held with a yellow strap that comes with the healthcare units. This one's a subcutaneous injection that's being given on the back of the arm, and it's being held in place by the strap that comes with the personal units. This injection is being given while the patient is still holding it. And then in other situations, the person who's giving the shot may move the Buzzy slightly and press it and hold it while they're giving the shot. One tip is, if you can see my hands, if you're holding the Buzzy and then pinch with the fingers so that then the shot can be given, that's also an option. So it's just that you want to make sure that you've got the Buzzy active and with cold, interrupting the nerve signal while the injection is being given. Now, in terms of this, how long do you leave it on? 30 seconds is usually adequate for the cold vibration to work. If it is a very painful injection, Humira, HPV, then you may want to leave it on up to 2 minutes. More than 2 minutes doesn't really give any additional numbing or desensitization. Now, here's how you use Buzzy for IVs or infusions. First important thing is you don't need to wait any time, because you're not, it's a superficial procedure compared to the IM. And even though you've got warm blood flowing toward Buzzy, because Buzzy's proximal to the procedure, you won't get vasoconstriction when it's flowing toward it. But if you do put Buzzy directly on the site, then you can get vasoconstriction. So instead, we don't recommend leaving Buzzy on for any period of time. Instead, just hold or place activated Buzzy proximal to the IV site. Now, you can either use the strap that comes with it as the tourniquet. You can put a tourniquet or a strap that comes with it on top of the unit if it's a mini unit. You can use both a tourniquet and a strap, as you see in this child here, the third one with the Lady Buzz unit, or you can just put a commercial tourniquet either through it or on top of it, proximal to your access site. Step 5, clean site the way you normally would and access it near the center of Buzzy's lower edge. So at no time is Buzzy in the same area or on the site for venipuncture. It's always going to be proximal and not directly on the site. Here's how you clean Buzzy. So really any kind of decontamination with chlorhexidine or alcohol or whatever your hospital uses is appropriate. Now, there are a couple different ways depending on whether or not this is a take it into the room with the person who's getting the injection and then take it out again, or if you're doing kind of an assembly line style. So you want to immediately sanitize it after each use. But in high volume situations, we've also had people who will keep the Buzzy units in a basket with the wings. And then once it's full or you need more, then you'll clean all of them in a batch. You're going to use the same hospital protocols as you would for a stethoscope or a sphygmomanometer, a blood pressure cuff, anything that is not involved in fluids or bodily concerning, any blood. You can certainly use bleach. Whatever your hospital uses is perfectly acceptable to use. The high-grade medical plastic that's used in Buzzy can withstand any kind of intense cleansing uses. Now, for patients with MRSA or who are immunocompromised, so one of the options is we do have the Buzzy infection control bags. Now, you could put this into a stat lab bag, but the thing is that the stat lab bags are going to be a little bit big, and so it's going to be moving around when you have the ice and the Buzzy together. So we do have appropriately sized infection control bags where the Buzzy can be placed. Alternately, some hospitals or systems will prefer to use an individual ice wing. So when the ice wings are being used, they're really all that's touching the patient. And so you can have a single patient ice wing. All of our equipment is reusable, but these ice wings have a colder white side and a less cold blue side. And that is, the white side's non-woven, so it can't be disinfected. So talking about the cost of Buzzy, speaking of reusable, because all of the components are able to be cleaned, the Buzzy comes with 2 AAA batteries that will last for approximately 20 hours. Those 20 hours will get if you take a 3-minute IV access as the longest possible time, that'll give you about 400 uses on one set of batteries. So even though we have patients who have been using the same Buzzy for 12 years, just assuming that you only get one battery set's use out of it, this is what the cost comparison is. A recent study in France by Lescop et al. Looked at the cost comparison between an EMLA patch and Buzzy and found that the incremental cost effectiveness of Buzzy was 11 euros, about $13 per point of pain lower. So this is much less expensive than anything else your hospital is using right now. So looking at regulatory and introducing this into a hospital system. In the US, the EU, Australia, UK, New Zealand, Buzzy is a class 1 device. In the US, it is 510(k) cleared to control needle pain. In Canada, Buzzy is a class 2 device, but in addition to controlling needle pain, it is also indicated to control needle fear. Now, Buzzy has been used at this point in over 5,000 hospitals and clinics. We're in 28 countries, and over 45 million needle procedures have been done to date. Probably more because we don't know all the people who are using it for all of their procedures at home all the time. The time savings for a hospital is one of the main reasons that it is brought in. So one study by Potts et al. Found that at the Children's Healthcare of Philadelphia, it took 3.5 minutes to obtain IV access with Buzzy compared to 40.5 minutes using Elomax. In the study by Lescop et al. And another by Bourdieu, to be able to get labs or IV access with EMLA was over 60 minutes. And this is because it takes 55 minutes for EMLA to be effective. So that makes sense. One of the questions we often get for implementing Buzzy in a hospital is how do you keep the ice wings? So there are a number of different ways. Some places will buy a freezer that is dedicated, which we do have. Some people will put it in the freezers, but only the ones that don't have sterile items in them. And some hospitals put it only in the freezers that do have sterile and don't want it in with food. So this is a pencil case that the University of Wisconsin uses. They will take all of the decontaminated ice wings once they've been cleaned in a batch and used. They put them into a pencil pack for school, and that's how they store it, and they store it in the freezer with staff's food. So there's a lot of different options. As you know, every infection control hospital or office is very rigid about doing it exactly the way they do it, and each one is slightly different. So this is going to be different depending on where you practice. Now, how to introduce Buzzy into your hospital or clinic. First of all, most hospitals, all hospitals are going to have a pharmacy and therapeutics department. The FDA code for Buzzy and for the musculoskeletal pain device Vibracool is the same because they're the same vibration unit. So we usually recommend that a new hospital implement both Buzzy and Vibracool at the same time on the same P&T paperwork. The payment for this is a really important thing to try to get right when you're introducing the device. So the places where Buzzy is the most successful and widely used is where pharmacy pays for Buzzy. And the reason they pay for it is because needle pain relief is not reimbursed. And because of the cost of the time for EMLA, which is a prescription product, which is reimbursed, because of that, most hospitals now in the US have moved to using Elomax because it's faster. It is not indicated for IV access. They never went for it. There's not a single study looking at Elomax and IV access. So because of that, it's bundled, and many hospitals save money by using Buzzy instead of Elomax, both for time and to not pay for that. Now, other places, Child Life will pay. There are nonprofit grants in some hospitals for specific use cases like cystic fibrosis, like diabetes, like Crohn's disease, lots of rheumatologic diseases, certainly diabetes. There are a number that will either loan out or give them to their patients. Hemophilia is one where we often have patients who, there's a group that will fund Buzzies for their patients. and PDSA, thrombocytopenia. So anyway, we work with lots of these different groups, but that's one way to get them funded to give to the patients who are going to need them at home. Certainly dupilumab is one where now we're seeing a lot of patients who are going off the medicine because of the pain of the injections and the difficulty at home. So trying to find parent groups or nonprofit grants is one way. And then many manufacturers are including Buzzy as part of their starter kit, either as an option for their patients or packaged in with the starter kit. So those are various ways to get Buzzy for use, either in your office or for the patients. And then no one likes to do something new. And certainly when you've dedicated your whole life to doing a procedure in one way, you don't want to learn that there's a better way. So it's really important to introduce the fact that Buzzy physiology that we're about to talk about, these are all recent discoveries. In the last 5 years, we know so much more about pain relief and pain control. So it's really a new thing, but still it's hard to get people to change their ways. So one important thing we've learned is that because IV access success is only 65%, if you just have people try it once, there's a 1 in 3 chance that that first IV they're not going to get in a pediatric emergency room. So because of that, it's important that when you're introducing this, it either be done as part of a training contest or group. University of Rochester gave a free t-shirt after someone's done 5 procedures, because that way they know that it will have a chance to show that it improves the success rate. Another way is to do a study versus standard care. Now, at this point, there's so many trials that we don't believe there's clinical equipoise. We think that the only real ethical way to do this is if right now you're not using pain relief for many of your IVs. And then the other thing is just because of the cost change versus standard care, to be able to reduce cost based on whatever you're using, or to make things go faster, those are effects that quality and that flow can see. So those are some of the suggestions that have been effective in introducing the behavior change that takes to use Buzzy. All right, some quick troubleshooting, and then we'll go into the science of how it works and some of the cool things that have been discovered in the decade of research that's been done. So, ice wings. The ice wings need to go laterally so that you can read the logo. If you put the ice wings in sideways, it will snap the little silicone that's on the back of the XL unit. So don't put them in vertically, put them in sideways. Now, one other thing about this is that the way that it works with the ice, you want to cover as much, as many dermatomes and as much area as possible. So putting it vertically is not going to interrupt the signal as much as horizontally. You want to cover a band of nerves as they go through. The other thing is that people often ask, can we put these in the refrigerator? Can we use them as a gel? As you'll understand when we talk about the science, gels are not going to transmit the vibration adequately, and the intensity of the ice needs to actually be frozen for the best descending inhibitory control. So if the ice wings are just cold, I recommend letting a patient hold it in their hands, but don't put it on the Buzzy. Likewise, if the ice wings are too cold for the patient and you don't have the ones with the non-woven, you'll get a lot of the effect from letting a child or an adult hold the ice in the hand on the same side. So that is an option if the local use of ice is too cold. All right, here's the troubleshooting on the vibration side. If you have a Buzzy Mini, it's going to have a dot switch on the top. We intentionally made this so that if you just touch it quickly, it won't turn on, because if you have a quick touch, it's going to turn on in transit. It's going to run down your batteries. So instead, you have to hold that for 1 second to activate the mini healthcare unit. Here's another battery tip. The reason that we made a mini unit available is because the frequency matters, and if the batteries run down to a certain point, then the frequency is no longer optimal for canceling pain. So in the XL unit, as you can see here in a really old unit, as you can see, you've got the wiring and the motor, and there's nothing that's interrupting it. So if the batteries run down, the motor is just going to go slower and slower. So if it feels like it's not working, it's time to replace the batteries. On the Mini, when we advanced to that, we added a circuit that detects if the batteries are low. And so if it's low, the Buzzy unit is going to give a couple quick bursts of vibration before it starts running. And that lets you know that the batteries are at 40% or lower and need to be replaced. So you're going to hear this bzz, 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 and then it'll start running. That means low battery. Finally, on all of our units, we do have a dot, and that dot correlates with the location of where the motor is. Because of how the frequency works to reduce pain, there's going to be a cone of efficacy that's closest to where that motor is. So you want to try to orient Buzzy so that the shot is near the dot, so that you're getting the most bang for your buck for pain relief. All right, so thank you for the practical part. Now let's talk about the science. How does Buzzy work? Well, there's something called gate control, and gate control in 1965 was described as using touch nerves to override pain nerves. There are 4 different primary touch nerves that we talk about. There's the Messner corpuscles, which are light touch. There's the Pacinian, which do motion. There's the Ruffini, which are stretching, like yoga, to decrease pain. And then there's Merkel discs, which are over time, if you get deep pressure, like acupressure, that's going to reduce pain. So what we're doing is stimulating the Pacinian corpuscles, and you'll understand why. So there's the shot near the dot. You can see where that flywheel is. And the reason for it is it's going to push the torque and the energy horizontally into the skin. So this is why we put the shot near the dot. And the ice part of it is combining with the vibration and these touch nerves. So these peripheral nerves here are the ones that are going to go to the spine. So the first one is the A delta nerve, and that's the sharp pain nerve that is a web all over the skin. This is why you want to have it cover the most surface area that you can, because A delta nerves are not just like one little point, it's a whole web. So these are the same nerves that you can block using lidocaine. It's a sodium channel that's in the A delta nerve that skips along, and that if you block the sodium channel, then the impulse stops and you don't pass along. So what Buzzy is doing is blocking the same nerves that you would block with injected lidocaine. Now, the C fibers are the cold nerves, and they're slow and small, and that's why we would leave Buzzy on for 30 seconds when we're using an ice pack, up to 2 minutes, is because those C fibers take a little bit longer to filter in. But the main secret sauce that's blocking pain is these A beta fibers. These are the fibers that are much faster than A delta. They're much more discrete, and they are doing the gate control that is the way to block pain. Now, this gate control is like if you bump your elbow and you rub it, that feeling stops pain. Or if you burn your finger and you stick it in cold water, that feeling stops pain. So the physiology of how Buzzy works is that we're overwhelming those little A deltas by getting a much stronger sensation. Now, the cool thing is that when you put it all together, it's a much more impactful sensation and nerve blocking than any one alone. What we have learned in the last 5 years answers a huge question in medicine, which is how come TENS units are so disappointing? TENS units are a transcutaneous electrical nerve stimulator. And many times, it's like Lucy in the football. We've been trying to use them to block pain, and they haven't. So the reason that Buzzy works is the reason that TENS units have let us down, and that is that 90% of the numbing of this gate control thing comes from the motion receptors. The frequency of TENS units is triggering the little tingly nerves, but the frequency of Buzzy is triggering the shaking nerves. And if you bang your hand with a hammer, I guarantee you, you're not immediately going, ooh, I'm going to lightly touch it. No, you're shaking it hard. So this is why the frequency matters for Buzzy, is because the 180 to 250 hertz, really fast vibration is what is going to trigger those deep position sense nerves. And that's why Buzzy has to be shaped the way it is and have the motor the way it is, so that the energy is penetrating into where those position sense nerves are to block the signal. All right, so now adding those C fibers, the ice. So in the brain, the pain pathway goes through the thalamus and then to this place called the anterior cingulate cortex. And it is really assessing whether or not, it assesses everything. It's the arbiter of cognitive conflict. Do I worry? Do I not worry? Is this a big deal? Is it not? How do I solve the problem? It doesn't solve the problem. It'll then pass it other places. It's just, what do I need to think about here? So what ICE does is it triggers in the ACC an assessment of risk. And so when the cold feeling goes up, the brain says, this isn't pleasant, but it's not dangerous. So let's suppress all of the signal that's coming up, because I've already assessed it. It's not dangerous, but doesn't feel good. One study found that if you burn, or if you put your hand in a bucket of ice water, you can tolerate more pain anywhere. I told this to my daughter, and she had strep throat. And she was away at college, and so I wasn't there to take care of her. And she said, you know, Mom, that thing you said totally worked. I put my hand in a bucket of ice water and my sore throat was better enough that I could do my homework. It hadn't even occurred to me how impactful this is, but this whole descending inhibitory control that the brain sees it and then sends and signals down to shut out the pain, that's how the ice is working. All right, so how to use Buzzy in other places besides an IV or IM. So if you're giving in the arm, if you're giving a stomach injection, like for IVF or insulin, you're going to do the same, or Humira, you're going to do the same thing. You're going to put Buzzy on the site for 30 to 60 seconds to pre-numb it. Then you're going to slide it laterally in the same dermatome, and then do the injection. Now you're going to clean the site, slide it laterally, clean it, and then gooing it, and then keep the shot near the dot. So because the motor is there, that's where the cone of the vibratory inhibition is going, and just teach patients just to slide it a little laterally and then go. For an infusion, you're going to do the same thing. And by the way, all the children and the people who are in this presentation have given permission explicitly for this to be used for educational purposes. So when you're moving between the brain and the pain, it's going to go right where you're numbing, right where you want to put the infusion needle. Now, people ask often, can you use this in addition to EMLA? Can you use it in addition to LMX? Absolutely. In fact, one of the cool things is that Tegaderm hurts to remove. So you can actually move Buzzy out right before you go and remove the Tegaderm using the Buzzy to block the pain of that. Again, if it's a patient doing this at home, hopefully they will have the personal use wings, and that will let them switch it to a less cold side if they want to, and they can hold it in their hand if they need to. So you're going to slide Buzzy laterally and then take off the Tegaderm, clean, and then do the insertion. All right, so these are what dermatomes look like. The nerve signals are transmitted. If you think about shingles, the reason you get a band of shingles is because it's in a dermatome. So Buzzy's got to go between the brain and the pain, or proximal to wherever the insertion site is, to interrupt the signal. So pretty straightforward on arms, but when you start getting into port placement or areas where you're accessing a port, or you're putting in the clavicle, then it's actually good for patients to test, just because those dermatomes are not rigid and hard and fast, and each patient's going to be different. So the first time using a toothpick or something like that to feel if you've got it in the right place where the dermatome is, just so you know. For sub-Q, you're going to want to put it on the back. So any place in the area that's coming off of the back of the spine, around, again, for the arm, it's going to be pretty linear. And you would just want to slide it up a little before you do the insertion or the injection. For the hips, same kind of thing. Just make sure that you test it before, but just know that for the L spine and for the thighs, it's going to curve around the buttocks and then move over into the front and be a little curvy. For IVF or in the back, it's going to go, you're going to want to put it almost on a diagonal, up and centrally. So let's now talk about the approach for vaccination or using Buzzy as part of a comprehensive pain program. What we know now is that all pain happens in the brain. You might get a signal from the periphery, but the interpretation of it's in the brain. For example, you may have seen someone with a fake arm and they've been touched and their brain has been convinced that it's the real arm. They still feel pain, even though it's a rubber arm and there's no nerves. On the other hand, you can have someone who is tackled in an end zone and something that you would think would cause pain, and they feel nothing because they're so excited about what's going on, their brain isn't worried. So pain is an opinion, pain is an emotion, pain is your body's best guess of how safe you are, but it's not what happens in the periphery, it's how your brain perceives it. So yes, we can reduce pain with the physiology of vibration and cold, but we also need to address the fear and the focus, and Buzzy does help with that as well. So ideally, when you're looking at giving an injection, you want to make the patient as comfortable as possible. So this little guy here, yeah, he's getting it with Buzzy, but you can tell he's still anxious. He would do a lot better if he was in a position where someone was comforting him to reduce the fear, and if he had something to look at to distract him. Like this little girl, she's on someone's lap in a position of comfort. She is being shown cards or distraction cards that activate the anterior cingulate cortex. They are causing this task to be done that blocks the pain from going everywhere else in the brain. And she's got Buzzy. Now, mind you, it's a little farther away than I'd like, but she's got Buzzy doing the physiologic part of pain relief. So she's reduced the fear with comfort, improved the focus on something else, and we're reducing the pain with Buzzy and ice. Now, here's a couple things that we've learned about physiology with needle pain comparing Buzzy to other options. When you're looking at EMLA, which is lidocaine and prilocaine, it really does take 60 minutes to work, and it will vasoconstrict if you do the IV access less than 60 minutes. So this is going to add a lot of time. It's a great choice for an LP, but right now it's often used a lot with port access. So a cool study that was done in Sweden looked at EMLA versus Buzzy for pain with port access. The interesting thing was EMLA was a little bit better than Buzzy for pain. However, patients who had had cancer and needed their ports for more than 6 months preferred Buzzy. And the reason was because the CV is cold vibration. The reason is because the brain knew they were safe by that time. And so they didn't want to wait. And they were more bothered by waiting for the EMLA or having their fear increased by the EMLA. And so instead they started choosing Buzzy. So I think that that's something that's a really important part of this, is that when you have a very painful procedure involving the patients, and using Buzzy as a tool and not the end all be all is an important thing. So this is something that I often get questions. Do we have to use ice? Do we have to use ice? For venipuncture, we've always said yes for everything, but actually a study in adults found that using the ice was about 10% better, but the vibration for venipuncture was most of it. So that's something that if you don't want to use the ice for venipuncture, either because they have a history of vasoconstricting, or because it's in a sensitive part, or because you just don't have the ice wings there, by all means, use Buzzy by itself, even if you don't have the ice around for venipuncture, because it does help, but it adds about 10%. In contrast, for IMs, there are only 2 studies where Buzzy hasn't been effective, And both of those were for kids younger than 4 when they didn't use the ice. So for intramuscular. So definitely the ice is very helpful for intramuscular, but for venipuncture, you cannot do it. Now, invariably, at some point, somebody says, oh, but doesn't Buzzy change lab values for venipuncture? So there was a 2013 study by a guy who was funded by a light. So it's a transilluminator where they didn't use a tourniquet. And this is a lot of inside baseball stuff. If you're doing this for injections, it just doesn't matter. But the reality is that tourniquets will, over time, slightly change blood values. Buzzy changes lab values less than a tourniquet because the high frequency vibration vasodilates and you get increased blood flow. So looking at this, if you are looking at blood collection, about 2 to 3 minutes is where it changes the lab values the most to have a tourniquet used. And so Buzzy changes lab values less than a tourniquet. You can see here that like hemoglobin, a tourniquet is going to change at 2.6%, Buzzy 2.5. This is just saying tourniquets, if you leave them on too long, are not good, but Buzzy makes it a little better. But does not change lab values. All right, so now the physiology, this is looking at the ice for IMs, and the interesting thing was that Buzzy was equivalent to EMLA when used with the ice packs. The other thing is that the researchers in this one study, they did not think that there was equivalency, but the parents did. And so I think that there's also, when you're introducing Buzzy, you have to realize that sometimes nurses would prefer to have a smaller number of rotating patients so they get to know them better, or just so they have more time. So there may be some reasons why people would rather have something that's going to take an hour to work, especially when it gets hard. And the one study looking, Benjamin was a study that looked at IMs, and that was with vaccines in kids younger than 4, only used vibration, didn't use the ice pack. And that was one study that did not find a statistically significant difference. The other 80 did. All right, so let's talk real quick about adults and COVID. And then because I said 45 minutes, I'm going to let you have a question. One of the big things that's happened now is that people are afraid of needles, but they don't talk about it. Because in 1985, we started giving booster shots when people were too young, when people were old enough to remember. And so now we asked a bunch of people who didn't get their COVID vaccine, how afraid of needles are you? And 52% of them were 3, 4, or 5 out of 5. When we asked the same group of people the question, are you afraid of needles? Only 16% said they were. So it really makes a difference how you ask. And some people who faint are not afraid of needles. It's just a genetic predisposition. So 3 to 5% will faint, but of people who faint, 70% of them have a relative who fainted also. So about 1 in 20 of the population have this predisposition. But if you're already a fainter, you almost always have a relative. The more fear there is, the more likely they are to faint. And the reason is because the fainting sensation comes from a sudden drop in blood pressure. And if you're more anxious, your blood pressure goes up to begin with. And so that change is greater. Females are more likely to faint. People remember the males, but it's actually females who are more likely. Low weight, low blood pressure also contribute. And you don't have to be afraid to faint. So they're conflated, but they're not actually the same thing. The reason that Buzzy is useful is because what's happening with fainting is that it's a parasympathetic response. The vagal nerve triggers this drop in blood pressure to lower your risk of bleeding out. Sometimes I call it the warrior gene, because if you're someone who passes out when you get stuck with a needle, if your ancestors were on the battlefield and got stuck and immediately passed out, they are not going to die in battle as much as the people who, like the Black Knight from Monty Python, kept fighting and then their blood's gone. So what Buzzy is doing is it's a sympathetic stimulator. So if you look at the way that the veins are, they're covered in this vagal nerve. And so if you penetrate them, you're more likely to have fainting. Buzzy proximal is going to be putting a very high frequency sympathetic stimulus that counteracts this. So many people will use Buzzy just to not faint, whether it's for an IM or an IV, rather than because they're afraid or because of the pain. All right, we're getting close to the end, and most of the new information that we have, I have shared now. So if anybody has a question, please put it into the chat, and I will talk about our approach to giving vaccines using Buzzy. It's been proven by Chris France that if you ask, do you have any issues with needles, it does not increase someone's likelihood of fainting. They say no, you say great. If they say nobody likes needles, or well, they're not my favorite thing, then go down this pathway. If they say I get lightheaded, then you can be very, very specific about how to decrease the fainting. So ask them what bothers them. Is it pain, anxiety, or fainting? And if it's fainting, they can tense their stomach muscles, and you let them know that you've got something that will help. If it's the pain, then you can work with Buzzy and a distraction. And if they have anything that's worked for them in the past that's been effective, say, great, we're going to be able to use that and some new things. So I have a question asking about using Buzzy on babies. Let me just stop the share for a sec. Actually, I'll just keep this up. So yeah, so both Buzzy and ice packs are FDA 510K exempt, meaning that they are safe. There's no age limitations on them. So for heel sticks on neonates, there are 2 studies that have been done using vibration in neonates. They were not the right frequency, but one of them did. It wasn't statistically significant. I mean, the article said, oh, it helps, but they didn't use the right frequency. And it did, so people are using it for heel sticks. We don't have specific data on that. We do have data for injections in plantar, in foot, in adults, and it is statistically significantly better than cold spray. So yes, it should work, but we don't have specific data. It is safe in neonates. It is being used for CPT, for chest physical therapy, but again, there's no specific data on that. The youngest data we do have 2 studies looking at vaccines. One found Buzzy to be equivalent to breastfeeding, and another found Buzzy to be superior to music and something else for the 1-year-old shots for measles, mumps, rubella. So we don't recommend using ice on the younger babies unless it's something where they're going to get multiple injections in a short period of time. So Synagis, if you're getting Rocephin, IM, the babies are able to remember enough that it causes increased duration of crying the 2nd and 3rd day they're getting a shot. So in that situation, they may not like the ice as much, but it is going to be better, and they'll have less of a bad reaction in terms of how long they scream for than not using the ice. So your mileage may vary. The interestingly, the breastfeeding study in the newborn vaccines and the recent one with the measles, mumps, rubella, they both did use the ice. So and it was a significant benefit. Anonymous attendee, did that answer your baby question, or do you have a more specific one? This slide just shows the preponderance of evidence about Buzzy compared to anything else. So the blue ones also talk about fear and not just pain. If it is a box around it, that means it's adults. And so we've got adults and pediatric. And as you can see, there are no LMAX studies. And that's intentional. I talked to the You're welcome. I talked to the company, and they're like, yeah, we didn't seek an FDA clearance for IV access, so we didn't do any studies. There you go. Looking at negative studies, like I told you, I think there was this one study with IV access. This was in adults. And so the adults who were getting IVs, they weren't that afraid. It was in population. So there was no difference in it, basically because adults weren't concerned about the IV access. They all rated very low. Yeah, everybody's pain was 2 or less. And I think also it's worth noting, a lot of people will bring up the prongs with shot blocker. The prongs are going to be stimulating just the Merkel discs, and that doesn't do very well for pain relief. So good for perhaps the focus, good for the fear, but not very good on the physiology. So there's no studies that have been found that shot blocker is effective compared to placebo. And well, it's equal to placebo. It's not better than placebo. And there was one study for insulin where it was equivalent to Buzzy. So Buzzy was better, but not statistically significantly better. And I think that that's because those patients have been doing insulin for a long time. All right. So going back to the vasovagal, just there's one study that was done by the CDC, and they compared music to music plus Buzzy to Buzzy alone. And the only person who fainted was in the music group. I am interested to find out if somebody does more work with this, looking at increased uptake or decreased delayed onset muscle soreness after the COVID shot. A lot of the nurses who used it were saying that they didn't think their arms hurt as much as other people's did, but there's no specific paper on that I'm aware of. So all told, Buzzy is the most effective pain control to address, in addition, fear and fainting. And we're up to now 45 million needle procedures, reduces pain 75% in adults and kids, and fear 50%. And I'll let you ask any more questions. Thank you so much. And we've got references that are available. We'll give them to everybody. Can I answer any questions? I do. We do have a new device that is going to be for dialysis. It's the Buzzy Pro. It's got a slightly bigger ice pack, and it's we're waiting for it to get its FDA 510(k) approval, but it should be available this year. Getting out the box for it. All right, if we don't have any questions, I'm giving you a sneak peek here of what Buzzy Pro is going to look like, and then the single patient ice packs that come with it. Look like that. So perfectly cover the site. Like that. Right. Thank you very much for attending, and please direct any questions to support@paincarelabs.com. We have multiple things available for support. We've got the poster that we can email that has the directions that I showed you at the beginning. We've got the bibliography. We've got copies of most of the PDFs. If you have a science team, we have videos, and thanks so much for supporting Buzzy. Oh, I just see some questions here. I'm so sorry. Oh, when Buzzy Personal, and when you should, hospitals and clinics should never be using Buzzy Personal. We intentionally underprice those to try to make them available to patients. Hospitals should only use Buzzy Personals if they are dispensing them to the patient. It is a violation of both our contract and of decency using the personal units in the hospital setting, because by definition that means you're not using the ice pack, so it's not being optimally used. And the mini is only available in healthcare. Oh, question about I've heard feedback that vibration moves the vein. So you do feel it differently, but it actually is in such a low amplitude, it can't move the vein. So people will say it moves the vein, and that's just that it does feel different. If they're used to feeling for the vein to get it, they will feel the vibration, but the vein isn't actually, it can't move at all. Even for infants, it doesn't move. So you can look at it you can look at Buzzy under Doppler, which we have. You can see when you put it on, you can see the vasodilation. So it vasodilates at about 150 hertz. And so you can, and it takes about 8 seconds because of the sympathetic thing. So you can watch it pop up, but you can also see that it doesn't move at all. And they don't feel comfortable using the Buzzy and their tourniquet together. There's no reason. I mean, all of those different ways have been done in the studies. So if they don't want to use the tourniquet with Buzzy, then they can use another tourniquet and have someone hold it on, have the patient hold it on, have the child life, have the staff hold it on. That's also perfectly appropriate. Yes, we will share the slide deck. I may reduce some of the, oh, thank you, Kim. That's very sweet. Yeah, so here's the thing. So somebody says it'd be awesome if future versions could be charged instead of using batteries, but great product. Thank you. The deal is that in order to make a rechargeable product, you have to have a lithium-ion battery, you have to have a board, you have to have several kinds of chips in it, and the cost of the device would go up to about $500. So we're not opposed to doing that, but it is a lot of investment. And because it's reusable, most places buy one or two, and that makes it kind of cost prohibitive to make a change that we really couldn't recoup the costs on. So it's just an economic reality. I would love that too, but that is what it is. Oh, dental use details. Okay, so there's now 7 studies that have looked at Buzzy. Thing is, Buzzy is going to transmit beautifully through bone. So just holding it on the cheek, and it's been done both with and without ice. I think actually the ice helps a lot in this particular environment because of the pain. So yeah, so putting Buzzy plus the ice pack on, and then having the patient, they don't really need to wait that long for it, just putting it on, and then the time it takes to get ready, and then do the palate injection. It's simple. If it's going to be an injection in the lower mandible, then it needs to just be pressed against the bone there. But it's really a good principle in general. The bone is where you want to press Buzzy for, if you're doing a port access, pressing against the bone transmits the sensation more broadly. Yes, you can use a presentation with clients. And the affiliate program thing, we're kind of in flux on, but Raven R. Wilson at paincarelabs.com is going to know where we are with the affiliate programs. Oh, facial, yeah. So facial injection experience, fillers, and Botox. Ms. Universe actually uses Buzzy for her fillers and Botox. So electrolysis, fillers, Botox, it's going to be the same thing. You've got a great bone structure. So if you're doing a filler, the nerve comes out here, and then it's going to spread over the facial nerve there. So if you're doing an injection here for Botox, then it can either, ideally, it would actually be like just below the eyebrow, and then inject here. But honestly, because the bone transmits so beautifully, you can really put it anywhere. Also dermatology. So injecting for steroids for alopecia. That's also something that, yeah, you can get the dermatome right, but honestly, for the head, it doesn't matter because the bone on the scalp and the skull are going to transmit that vibration so well. The fillers, Botox, I mean, that's the same thing. So we've got some lovely video of Ms. Universe with her bee, you know, adorably just on her face, and she's getting the Botox for her fillers and stuff like that. But yeah, anything around the mouth is really painful. So putting it right about there is the best placement. So So the question about, so the question was, Dr. Baxter, you say it should be used for a maximum of 2 minutes. What do you think about longer term use for higher levels of pain, for non-injection pain? So for a needle, and this is actually, this is not to my knowledge published, but Buzzy is used at a lot of the rheumatology camps. And so patients who are getting Humira or Enbrel, or some of the more, before they took out the citrate, some of the more painful injections, they're at those camps. And so several of the counselors who have worked with Buzzy and patients who are getting these painful injections for Crohn's or whatever, they say that really at about 2 minutes, that any additional time is more just because the patients are anxious, but it doesn't seem to make a difference for pain. So just for needle pain and IM injection, that's where I think 2 minutes. After that, you can do it, but you're not doing the peripheral nerves anymore. You're doing something that's more for your focusy. Now, for musculoskeletal injuries, definitely, I mean, our Vibracool devices, we recommend for 20 minutes, but anybody who's got chronic pain can tell you, like, I will get some of the best bang for my buck at about 45 minutes using it with the heat. 20 minutes is more because the research for danger with ice actually goes up to 60 minutes and doesn't have problems with frostbite. We make our ice packs so that they will melt before it's possible for them to have thermal energy that will damage anyone. Certainly when I've had acute injuries, and we hear, other people with acute injuries will sometimes switch out the ice pack, so they're doing 40 minutes. So no reason not to for that. And if you've got an ongoing recent injury that's causing swelling, that's causing edema, that's actively in the damaged portion of the injury, then longer, there's no reason not to. And many times people do. But yeah, but I think that's about the question. I hope that answers your question. So for non-injection pain, yeah, it's a totally different beast. The 2 minute thing is just where you max out for your physiology of needle pain stuff. I've got there we go. All right, I'm out of questions, and thank you so much.